You may or may not be familiar with the term long haulers. It's used for people who suffer severe, persistent neurological issues, including brain fog, headache, numbness, and tingling, along with a host of other COVID-related symptoms. Now the family of Kent Taylor says he died by suicide after suffering from severe tinnitus and other COVID-19 related symptoms. Taylor was the founder and CEO of the Texas Roadhouse restaurant chain. COVID can make tinnitus worse. It's a condition that causes high-pitched ringing in one or both ears. We reached out to Dr. Niket Sonpal to help us understand what long haulers are facing.
So before we get into how severe these symptoms are and what we've learned over the last few months, for people who might not be familiar, what does being a long hauler mean?
In essence, a long hauler is someone who has symptoms or remnant effects after contracting the COVID-19 virus, and they range from long-term joint pain to things like tinnitus, headaches, etc.
And they can be weeks or months after.
Yes, correct. Some patients have said that they've had it for a few weeks, like fatigue. Others have said they've had symptoms for months, and some are dealing with it for even longer.
The family of Kent Taylor, the founder of the Texas Roadhouse restaurant chain, points to COVID-related symptoms as one of the reasons that he committed suicide. And they say that he suffered from severe tinnitus. You just mentioned that. Is that one of the more common symptoms?
In terms of what's the most common symptom for long haulers, it's as individual as each individual person. What happened with Mr. Taylor is definitely tragic. But what it highlights is not just the fact that COVID-19 has a lot of long haul symptoms, but also that COVID-19 can cause symptoms that can lead to mental health issues as well. Depression, anxiety, and for many people, even just the PTSD or acute stress of having it can also be very, very difficult.
So it can cause physical symptoms, emotional, mental symptoms. Can it make any symptoms that you already have worse?
It's a little early to tell. I know there's a lot of data that's looking into pre-existing conditions and how they change after. One thing we do know is there's a little data coming out that says people who've had long haul symptoms, we are recommending everyone get vaccinated. They're noticing that some of the long haul symptoms are beginning to curtail a bit or improve. Now, the mechanism of how that happens is still yet to be flushed out. Because it's a new virus and we've just passed the 1-year point, we have to give the scientists a great deal of credit for A, figuring out how it works, B, getting the virus vaccine ready, and now it's time to flush out why those sort of nuances occur and why these long haul symptoms occur.
So we think that the vaccine might help someone who's suffering from long haulers' symptoms.
Yes, everyone should get vaccinated regardless of if they've had it before. And there's some preliminary data. Now, what long haul symptoms have improved or not, there still needs to be a great deal of research into that. But there is some preliminary data that suggests so.
You have to have severe symptoms when you're actually in it, in the COVID illness, to then have long hauler symptoms? Or could you just have had mild symptoms, but then a week, 2 weeks, a month into it say, something's wrong?
That's a great question. A lot of people assume that a severe course means a severe, longer course even after recovery. I've had patients who had very mild symptoms, but then experienced significant fatigue for months and months, and one who's had headaches for many, many months since thereafter. So I don't think there is a correlation yet as to say so. But remember, when these things happen, we need larger numbers of patient points to be able to make a conclusion one way or the other. It's still a little early.
Yeah, and some of the symptoms that pop up might not be symptoms that you had, again, while you were sick.
Absolutely. It doesn't mean that if you had joint aches and headaches, that's what's going to be your long haul symptom.
I know just over the last couple of months, we've learned more about long haulers and the different symptoms that are all sort of included. Mm-hmm. Do we have any idea why some people suffer from the longer term symptoms and others don't?
It's a great question. And my patients have asked me the same thing. And honestly, we're not 100% sure yet. There still needs to be a lot of research into COVID-19 and how it does these effects and how it causes these things to happen. I'm sure, though, that as time goes on, we'll be better able to understand this.
Again, with the people who have been vaccinated, they feel, I've seen, comfortable going out in public. And we've learned more about this too, right? Do we know enough to say you can't transmit it if you have the vaccine?
It's a great question. And every patient I've had come in has asked, I've got the vaccine. It's been a few weeks since my second dose. Can I do stuff? And the answer is not quite. Just to give an example, in the state of Minnesota, there's an investigation going on into 89 individuals who developed COVID-19 after the vaccination. We know that it's 90 to 95% effective. So you still have to maintain wearing masks, hand hygiene, as well as social distancing, because there's still a percentage chance that you can contract COVID-19. In addition, we know that when you've been vaccinated, we don't know whether or not you can transmit it, but we do know that you can contract it. And by that logic, it's possible that in that false sense of security, you may transmit it.
Doctor, thank you so much. It's always a pleasure to talk to you.
Likewise, thank you for having me.